Hey everyone, today we're going to talk about small intestinal bacterial overgrowth. And as you know, we've been really focusing on gastrointestinal topics because we have a new program that we're launching called Gut Health Solving the Puzzle, where I teach you how to go through and evaluate your own gastrointestinal system. If you go to drknews.com, you'll see a link to find out more about the course, and we're going to be doing a pre-launch for the course, and people who have signed up to get information about the course earlier will get significant savings and promotional items. So if you have any interest in going through our online course about how to evaluate and learn strategies to support your gastrointestinal tract and gut symptoms, then please go to Dr. K News and sign in for Gut Health Solving the Puzzle and be on that list. Okay, so let's talk about small intestinal bacterial overgrowth. This is one of the key things that you have to understand if you're dealing with gastrointestinal conditions. And small intestinal bacterial overgrowth is one of these conditions that has become really popular in the internet, and it's being misdiagnosed. People are just all assuming that any kind of bloating or distension is small intestinal bacterial overgrowth. And there's been, a lot of misinformation about the topic and some confusion about it. Now, the key thing you have to understand, the main cause of small intestinal bacterial overgrowth is really not, it's a bit confusing, the term of the condition. When you hear small intestinal bacterial overgrowth, it's almost like you're thinking that either there's an infection in that small intestine or there's an opportunity where bacteria is overgrown. But really the best way to think about it is that it's small intestine bacterial translocation. So the way it works is you have different bacterial species in your small intestine and your large intestine. And in the small intestine, you don't have much bacteria. Majority of your bacteria is in the large intestine. You have hundreds of millions of bacteria in the large intestine. Only a few 100,000 bacterial species per deciliter of fluid when they evaluate. Per milliliter of fluid when they evaluate to determine the amount of growth. So we're talking about this big difference in bacterial population in the small intestine, large intestine. Most of the bacteria, the microbiome, is all in the large intestine. The small intestine has a very small amount of bacterial species. So what happens in small intestinal bacterial overgrowth is that bacteria that's in the large intestine moves across along the ileocecal valve, the valve that separates the large and small intestine, into the small intestine. And this bacteria that's in the small intestine is very, very prone, is there to ferment and digest starches and sugars. And when that bacteria is in the small intestine, when people eat foods that are high in starch, fibers, fructans, galactans, they'll get significant bloating and distension. Now, that fermentation normally happens in the colon. It's no problem. But when it happens in the small intestine, it causes significant discomfort, bloating, even nausea for some people. So one of the key things that's essential for even considering if you actually have small intestinal bacterial overgrowth is that do you have abdominal discomfort and bloating? And it's pretty rapid. It's within the first few minutes, 5-10 minutes, sometimes even immediately after you eat, like anything that's very starchy, any kind of simple sugar, sweets, even probiotics can really be a trigger for some people, or prebiotics, any kind of fiber source. So typically fibers and sugars and starches, things like legumes, really high sugary fruit like grapes, watermelon, they tend to be the most common triggers for small intestinal bacterial overgrowth. Grains like rice, quinoa, tapioca, they're going to really promote bloating, distension right away when people have this small intestinal bacterial overgrowth. And then there are what are called fructan-containing vegetables, and these are things like lettuce and cabbage and beets and asparagus and mushrooms. They also have this reaction with this bacteria that's now in the small intestine from the large intestine, leading to bloating and distension. So if you have bloating and distension, these are all things to consider. Now, however, you should know that not all bloating and distension is SIBO. And this is where a lot of misinformation comes with, and this is where a lot of people get confusion about it. Like a lot of people that have been diagnosed with SIBO, like self-diagnosed or internet diagnosed, really have a gallbladder issue. and and it's really the fats that they can't digest causing bloating and distension. Some people have hypochlorhydria, where they just don't have enough hydrochloric acid to break down proteins. Some people have pancreatic enzyme deficiencies. Some people have mechanisms where their motility is significantly compromised that's leading to these imbalances. So you have to really understand that not all bloating and distension is small intestinal bacterial overgrowth. However, if you're just eating any kind of simple sugar or any kind of high fruit and you're always bloated and distended, and one of the key differences is when, for me as a clinician, when I hear a patient come in and tell me, yeah, it's anything I eat, I get feel like I'm pregnant. I feel like all of a sudden my abdomen is distended and it's really, really uncomfortable. If that is something that is happening to you, then it's likely that you may have small intestinal bacterial overgrowth. Now, what I want to do is also get into like the prevalence and causes and what you do about it and so forth. But one of the key things is if you have bloating distension, one of the most important things you can use for diagnosis is to do a challenge with a Fodmap diet. Now, let's talk about how SIBO is diagnosed. So the first thing is you have bloating distension really with just any kind of sugary, fibery type of food. Grains also, right? Any of those foods. So if you get bloating distension from all those foods, the conventional approach is to do two major types of tests in a gastroenterology model. One is to do aspiration of the gut and measure the amount of bacterial species that are in the small intestine, do a bacterial culture. That has its limitations. It's also it's invasive. It's an invasive test. It requires you to go in. They have to aspirate bacteria and put in a culture from small intestine, and not all bacteria grow there, and it can be used to diagnose small intestinal bacterial overgrowth. Another form of test that's commonly used to diagnose small intestinal bacterial overgrowth is what they call a breath test. And in this breath test, they measure two different gases. One is hydrogen and one is methane. And methane or hydrogen levels, if either one of those are up, they can suggest that a person has small intestinal bacterial overgrowth. There's some problems with those as well, with that test as well. Not all people that have small intestinal bacterial overgrowth or have bacteria that's now in their small intestine have bacterial species that release methane or hydrogen. So if you have bacteria in your gut, in your small intestine, that is releasing other types of gases, it's not going to show up on this methane hydrogen breath test. Also, we know that people that have increased gastrointestinal motility and have frequent bowel movements, their increased motility may actually cause false negatives with the test. So if the bowel's moving very, very quickly, there may not be measurable amounts of gas to cause a positive test, even though they may have SIBO. So those are the two standard approaches, either aspiration or breath test that's used in conventional gastroenterology to diagnose small intestinal bacterial overgrowth. And if they're positive, then it strongly suggests that you may be suffering from small intestinal bacterial overgrowth. However, sometimes the best thing to do is just to do a diet called the Fodmap diet. And the Fodmap diet, FODMAP, stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyps. And that's what the FODMAP stands for. So basically, what you do in this diet is you remove these FODMAP substances, F being fermentable, and then O being oligosaccharide, disaccharide, monosaccharide, ODM. And those are just simple sugars. So oligosaccharide is few monosaccharide. So monosaccharide is a simple sugar. A disaccharide is two sugars together, and oligosaccharide is just a few monosaccharides put together. Basically, they're looking at short chain carbohydrates, and they also, and the P part of FODMAP is for polyols. Polyols are basically carbohydrate sugar, or basically sugar alcohols. And these types of simple sugars are easily, they really promote fermentation with this bacteria. That's where you get the gas and the bloating and distension. So the Fodmap diet is you remove all those foods. And one of the ways to really confirm if you actually have SIBO is to do a very strict Fodmap diet for about 10 days, preferably maybe 2 weeks. And if you notice your bloating, gas, and distension are resolved, it strongly suggests that you actually have small intestinal bacterial overgrowth. So, in a sense, one of the best ways to determine if you actually have SIBO is to determine if you actually feel better when you avoid the foods that cause fermentation when bacteria from the large intestine move into the small intestine. Now, if you have a positive response there, then the next thing to really think about is where are you in the spectrum of clinical presentations. So SIBO can get really serious. Some people with SIBO will end up with significant health problems, and then some people will just have some mild bloating and distension. Now, first of all, if you have SIBO, it's a red flag that you have some serious issues going on with your gastrointestinal system. And we'll talk about those in a second. But it is not, even if you just have a little bit of bloating and distension, you need to really address it and figure out what's going on and find the mechanisms, because it can progress. So when you look at the spectrum of small intestinal bacterial overgrowth, you have, you basically have some people that just have very mild bloating and distension whenever they eat foods that contain these simple carbohydrate sugars. Then it progresses to developing some malnutrition from it. So the physiological mechanism of small intestinal bacterial overgrowth are going to then lead into micronutrient deficiencies. These include your basic B vitamins, iron. So you start to see iron deficiencies, B vitamin deficiencies, mineral deficiencies. You also start to get deficiencies in things like vitamin D. Like you may never be able to change your vitamin D levels if you're taking vitamin D with SIBO because of the malabsorption issues. You may just start to develop nutrient deficiencies if you measure them with a red blood cell test to look at nutrient levels. It's common to be low. And then if it progresses and then it gets to the point where your nutritional deficiencies may then lead into anemias, like iron deficiency anemias, B12 anemia deficiencies, and that's just the progression of the small intestinal bacterial overgrowth causing malabsorption. So that's the biggest issue with small intestinal bacterial overgrowth, that it can really lead into malabsorption and malnutrition syndromes. And then if it progresses from anemia, what happens with small intestinal bacterial overgrowth is that it can start to impact what are called albumin levels and globulin levels. Albumin levels are proteins that you have in your bloodstream that are made in the liver, but albumin is involved with really controlling your osmotic pressure, so you don't have swelling. And when people develop very severe patterns of SIBO, they'll actually get edema throughout their body and swelling, really swollen ankles, really swollen face. If it impacts their globulin levels, which is another protein, globulins make immunoglobulins or antibodies to get severe immune compromise. It can impact hemoglobin, which is another globulin, so they can get severe anemias that don't respond to B12 or iron. And then if their malabsorption patterns get worse, you start to see the total cholesterol levels drop on their lab tests, white blood cells start to drop, and they really become a significantly malnourished person, then suffering from malabsorption syndrome, and then they can actually have significant weight loss. And it can go down the spectrum from just general bloating and distension to very severe symptoms. And what that means to you is that if you have some bloating and distension and you go on a FODMAP diet and your symptoms go away, first of all, you have SIBO. And if it continues to get worse, you may end up with some significant malnutrition, malabsorption patterns as the condition itself tends to progress. Now, you should know that when you look at like what causes SIBO and you look at the severity of SIBO and all the things that are involved with it, there are several key things you should know. Now, when you look at people that are prone to getting SIBO and what the mechanisms are, first of all, if you don't have enough, the easiest and most common mechanism is, not most common, but common, is that you have a person that just doesn't have enough hydrochloric acid. So people that are on protein pump inhibitors, they tend to end up getting small intestinal bacterial overgrowth. People that have anything that's impacting the nervous system of the gut, which is called the enteric nervous system. So when you look at the gastrointestinal tract, The gastrointestinal tract has nerve plexus that cause your intestine smooth muscles to constrict and to move food, and they also close down the ileocecal valve, the valve that separates the small intestine from the large intestine. And if the gastrointestinal nervous system, also called the enteric nervous system, starts to dysfunction, then what you start to have is you have inability to close the valve between the small and the large intestine, so bacterial properties can go through. And then if the smooth muscles are not contracting well, then bacteria starts to move from the large intestine to the small intestine. And that's all part of a gastrointestinal nervous system dysfunction. Now, sometimes it's further up. The input to the gut happens from the brain to the vagus. So people that have traumatic brain injuries start to develop small intestinal bacterial overgrowth. Their brain injury tends to cause what's called vagal dysfunction or dysautonomia, and they can't activate their vagus, so they can't control their ileocecal valve. They can't control their smooth muscle contractions very effectively, and they end up with small intestinal bacterial overgrowth. Now, there's also the possibility of having severe immune compromise of the gut to cause SIBO, but when we talk about severe immune compromise, we're talking about things like HIV. We're not talking about just like you have a low SIGA count when you do a digestive stool analysis. It's got to be pretty significant. So we know that you need to have. So basically, when you look at developing SIBO, basically what's happening is either you're not acidifying your gut because you're not releasing hydrochloric acid. There's something wrong with the gastrointestinal nervous system. These are called migrating motor complexes, the nerve plexus in the gut. Or there's lack of input from your brain, the brain to the gut, and then those are some of the key mechanisms. Now we know that SIBO, when they do studies with patients that have confirmed celiac disease, about 10% of patients with celiac disease have SIBO. We know about 15% of just the general elderly population of small intestinal bacterial overgrowth. We know that when patients go on antacid medication, 50% of them end up with SIBO-like symptoms because of the antacid. Some studies have shown up to 80% of people that have been diagnosed and confirmed with irritable bowel syndrome has some degree of SIBO. 90% of confirmed alcoholics that are dealing with alcoholism have small intestinal bacterial overgrowth. And part of that is because alcohol itself destroys the nerve plexus. So now let's go into the underlying mechanism. So if you have SIBO, the first thing to remember is like, why do you have it? The easiest solution is like you're taking protein pump inhibitors, and that's the cause. And if you stop taking those, you get better. The second easy treatment to it is you just don't have enough hydrochloric acid. So that'd be another way to determine if you have any issues with it. Is if you can take hydrochloric acid as a digestive supplement, and all your bloating, distension, and symptoms go away, then that was probably the main cause. Now, the deeper question is, and the more troublesome issues is, what are some of these things coming from and what's happening with them? So the first thing to think about, what could be destroying the enteric nerve plexus in the gut? So what you need to know is that chronic intestinal inflammation is going to injure the gut, and it's going to injure the nerves in the gut, and it's going to cause scarring in the gut. So people that have celiac disease for a long time, they can completely destroy their gut nervous system over many, many years. And this is also why some people that have celiac or have severe intestinal inflammation, they don't really manage it very well, and they don't really take it seriously. There's some anatomy that's destroyed in the inflammatory response. So just as a simple concept, chronic intestinal inflammation, whether it's an inflammatory bowel disease or it's ulcerative colitis or Crohn's or celiac disease, is going to start to damage and injure the gastrointestinal nerve plexus. So that's one of the major causes of developing SIBO. People that have uncontrolled diabetes, if you look at their lab test, HbA1c levels are very high. The glycated end products, when sugar levels are high, they bind to other compounds in the body and create free radicals, which then destroy tissues. So when you have high amounts of these glycated end products or the free radicals from uncontrolled diabetes, that starts to destroy the gastrointestinal nervous system. Pancreatitis, chronic pancreatitis can destroy the gastrointestinal nervous system. So these are the first things that you have to think about. Like, why did a person develop SIBO? What are the causes for that? Now, the other key things that are also very common is that early neurodegenerative diseases, especially Parkinson's disease. So Parkinson's disease is a neurodegenerative disease called an alpha-synucleinopathy, where this protein called alpha-synuclein builds up and it gets in the way of normal transmission of neurons, and then this what causes the neurodegenerative process. But this alpha-synucleinopathy starts in the gut, sometimes 10 to 20 years earlier before it gets into the brain, and one of the earliest manifestations of that is SIBO. So some people actually have SIBO because they have early Parkinson's disease and they don't even know yet. Now remember, most people think of Parkinson's disease, they think of tremor, but tremor is one of the last stages of Parkinson's disease. So in the early stages of Parkinson's disease, people lose their sense of smell because this alpha-synuclein protein builds up in an area of the brain called the olfactory bulbs. They can't smell well. It also takes place in their gut nervous system, their enteric nervous system. So, if you have SIBO, you got to make sure you don't have early Parkinsonian disease, Parkinson's syndrome. And your biggest clues of that is just muscle stiffness, muscle rigidity, hand cramping. Start to write and you start to get hand cramping. Stiffness is usually in one limb first, like the arm first, like a frozen shoulder or like a really frozen hip. And then it progresses to other tissues. And then constipation. When people start to develop Parkinson's disease and they start to have this neurodegenerative process take place in their gut, this nerve plexus in the gut starts to degenerate and they have some issues. So a lot of times, when you see SIBO, one of the first things that we're actually thinking about is, do they have, especially if they're, 35 or older, do they have early signs of early Parkinson's disease? Parkinsonian disease, any Parkinsonism in their family tree? Those would be all some concerns. Now, some people get SIBO because they had radiation therapy to treat a cancer, and that destroyed their gut nerve plexus. So that's another possibility. Some people had surgery that changed their anatomy of their gut, so now they have SIBO. Another overlooked cause of small intestinal bacterial overgrowth is hypothyroidism. Some people are hypothyroid, and thyroid hormones are important to activate the migrating motor complexes, the nerve plexus in the gut, and they also activate the vagus. So those are the main things that are involved with it. So let me recap and make it simple and then kind of go through the process. And by the way, if you take the course we're launching in a few weeks, the Gut Health Solving the Puzzle course, we're going to really get into teach you how to dial all the different GI conditions for yourself and how to go through it. But let's go over some of the basics with SIBO, since that's the topic today. So if you have bloating, distension with any kind of basic sugars, carbohydrates, fibers, one of the best ways, easiest ways, inexpensive ways to really determine if you might have SIBO is to go on a Fodmap diet. You can just Google Fodmap diet. There's lots of free available information online. It was a diet developed by Monash University in Australia that is very, very effective. And if you respond and your symptoms go away on a FODMAP diet for 10 to 14 days, it's a big change there. The key thing is you have to do this diet very, very strict. Be very, very strict with your diet to make sure the diagnosis is correct. If you're lazy with your diet, you might think the FODMAP diet is not part of it. It's a lot, and I've seen that a lot. You have to be very, very strict with the FODMAP diet if you're using it for diagnostic purposes. And if your symptoms go away, then you have SIBO. Then the next question is, why do you have it? If you're not on protein pump inhibitors, if you're not hypothyroid, and it's not related to hydrochloric acid issues, now you're worried about a neurodegenerative disease or chronic inflammatory issues that are causing scarring, or maybe past injury to your nerve plexus from radiation therapy, or things like that. So those are the underlying mechanisms. Now, what do you do if you when you have it? How do you treat it? In conventional treatments, they'll use an antibiotic type of therapy. Rifaximin is the most common one. It's an antibiotic that's not absorbed very well, so it's very effective for SIBO. And then they may even give the patient what are called prokinetic drugs. Prokinetic drugs are drugs that activate the small intestines. They get small intestinal contractions. But what they find is, over 90%, some studies show up to 98% of people that get the conventional treatment have to get treatment more than once and ongoing, because it doesn't really treat the underlying condition. It just it just kills the bacteria that's in the small intestine. Within a short period of time, they come back. So it's one of these things that if you have injury to those nerve plexus, then you're kind of dealing with what you have and you're trying to optimize that function. Now, one of the most important things to consider when you have this is you have to start taking short chain fatty acids. So butyrate is a very important supplement, and since if you have to go on a Fodmap diet, your body is not going to be able to have fiber to impact the gut. And one of the things that fiber does is fiber gets metabolized by gut bacteria to short chain fatty acids, and these short chain fatty acids have major impacts on immune function in the gut. They activate regulatory T cells, they impact dendritic cells, they have an impact on receptors that control blood sugar levels. So you definitely want to get your short chain fatty acids from a supplement, since you can't get them from fiber because fiber causes a problem. You also want to make sure you adhere and are strict with a Fodmap diet, because here's the thing. If you have SIBO and you eat foods that cause bloating and distension, so let's say you just really like watermelon, you get some bloating with watermelon, but you're still happy eating it. Every time you get bloating and distension, the ileocecal valve, the valve between the small and large intestine, that bloating and distension opens up that valve, which then causes more translocation of bacteria. So you have to realize, if you're really trying to get your health back with SIBO, maybe you have malnutrition, malabsorption, you have to really adhere to the Fodmap diet and make sure you have no bloating and distension. Every time you have bloating and distension, you open up the valve between the small and large intestine from that distension, which causes more translocation, so you really have a hard time fixing it. You can also use, very common, naturally antibacterial compounds that are available, like berberine is a very common antibacterial. Olive leaf extract is a common thing people use. Taking digestive enzymes is really important as a basic concept. And many people that have small intestinal bacterial overgrowth, the inflammation in the small intestine from this bacterial species there will lead to leaky gut intestinal permeability. So this is an ongoing issue with being very strict with the diet, making sure your colon to get some short chain fatty acids, ongoing leaky gut issues, and you're trying to control this to the point it doesn't really cause malnutrition, malabsorption issues. So those are like the basic fundamental concepts about SIBO that I can share with you just in a Facebook setting. In our Gut Health Solving the Puzzle course, I have charts and diagrams and recipes and menus for you to follow and go through it. But with the limitation of live Facebook, that's kind of the covering the gist of those things. And I've got my wonderful wife here, Dr. Andreas, to help me. And if you guys have sent in some questions, we can go over those. And by the way, thank you all for joining in. And it's really nice to have this community to share information with.
Okay, so let's get into it.
Okay.
Tamara is asking, how does SIBO feed/create candida? Does it?
Well, yeah. The thing so first of all, candida is a normal yeast species of the large intestine. Mm-hmm. And just like bacteria can translocate over, yeast species can translate over into the small intestine. And they're very prone to leading to fermentation with any kind of sugar exposure, which leads to bloating and distension. So part of it is just the mechanism of bacteria moving across the small intestine. Also, yeast species go across the large intestine, and this makes them very sensitive to sugar. When people that have it, they're very sensitive to sugar. But another part of it is that with small intestinal bacterial overgrowth, there is some significant environmental changes in the gut that actually lead to weakened immune function in the gut. And that weakened immune function can also then lead to overgrowth of yeast organisms, not just in the small intestine, but in the large intestine. So it kind of adds more to what's already difficult, which is an extreme sensitivity to any kind of sugars in the diet.
Okay. Susan, how can you tell the difference between gallbladder issues versus SIBO?
Yeah, so your biggest clinical tell between a gallbladder issue and SIBO is that it's fat versus sugar. So, and some meals have both, so it's hard to determine which one really triggered it. But if you just eat, let's say, something that's very fatty, like just let's say olive oil, a teaspoon of olive oil, or you take a fish oil and you get immediately bloated and distended, That's a sign that's really a gallbladder component. It has nothing to do with SIBO. And a lot of people get misdiagnosed with SIBO with gallbladder issues.
Yeah.
So that's the key thing. The key thing with SIBO is it's really these short chain carbohydrates. Short chain carbohydrates are very prone to fermentation. So that's where fibers, grains, simple sugars are the key diagnostic thing. So if you're eating just a simple sugar and you get bloating and distended, have no problem with fats, it's most likely SIBO. If sugars don't really cause a problem for you and it's really just the fat that does a problem, it's more likely gallbladder. And guess what? Some people have both. And that's a very real thing as well.
Okay. So Sarah is saying, I have been on a low Fodmap diet for probably too long, but don't know what to do because I can't function otherwise.
Right.
Despite many tries with antibiotics, what do they do?
Listen, if you have SIBO and your enteric nervous system is damaged, your health is going to be improved staying on a Fodmap diet. It's just that simple. Now, the question to ask, first of all, just there's some things you can do to completely reverse the SIBO, and there's some conditions that have caused destruction of these nerve plexus, so it's hard to reverse it. So if you have SIBO, make sure you don't have hypothyroidism. Make sure you get a lab test, check your TSH, make sure that's not high. Make sure you don't have hypochlorhydria, which is low hydrochloric acid. Most common cause of hypochlorhydria is just an H. pylori infection, so make sure you don't have an H. pylori infection, hypochlorhydria type of pattern, or just take some HCl, see if that gets rid of the symptoms, and if it doesn't, then you got to go, well, why do you have it? So do you have uncontrolled diabetes? Does that need to be handled? Do you have celiac disease or an inflammatory gut issue that's led to scarring? If that's the case and you really have damaged those nerve plexes, you have to stick to a Fodmap diet. And if you don't, you can have some significant malnutrition, malabsorption issues. That's the key thing. And you got to make sure you don't have really signs of neurodegenerative disease like Parkinsonian, because SIBO is it's a very common way for early Parkinson's disease to present in a clinical setting. So it gets overlooked by all types of healthcare professionals all the time. So those are the deeper questions. But if you have this unfortunate pattern of having your nerve plexus injured from some underlying mechanism, that's an issue. Now, the other thing we talk about in the gut health solving the puzzle course is we talk about doing vagal exercises, such as gargling. Gargling will activate your vagus to activate your enteric nerve plexus, because at some sense your smooth muscles in your gut need activation to stay healthy and contract. So we go over lots of different vagal exercises in the gut health solving the puzzle program, but the easiest and most common one to do is just to take some water and gargle with it. And when you gargle with water, the back of your throat, you have these muscles called palp muscles, and they start to contract. And when they start to fire and contract, you actually fire what's called the vagal motor nuclei in your brainstem, and that fires into the gut nervous system and gets those gut plexus to work. So you can try to really start to do a lot of vagal exercises, see if that can help you get more plasticity and develop activity in your gut. But there are definitely people that have to stay on a Fodmap diet to avoid malnutrition, malabsorption patterns because of injury and scarring of their migrating motor complexes in their gut.
Right. But if it's not just, they have to also explore other avenues, making sure there are not other things involved as well.
Right. So once you get diagnosed, figure out why do you have it is the next big part of it.
Right. Okay. That's, I think, the question people are asking.
Yeah.
Okay. Susan, how do I start the veggie mashup if I am sensitive to all vegetables? Bloating, head fog, gas. What do I do?
Right. So the veggie mashup that we talk about to support immune tolerance, cause microbiome diversity, is contraindicated if you have SIBO. It actually will make you worse because you're going to expose yourself to a lot of fermentable food sources. Now, the goal of the veggie mashup is to give your gut fermentable food sources so you can make more bacterial species, which has major benefits in health and can really impact what's known as microbiome diversity. But if you have SIBO, it would be a bad idea. because what you do when you have a veggie mashup with SIBO is you'll actually cause significant fermentation, and this fermentation process with these bacteria also creates inflammatory responses, oxidative stress. You'll start to break down your tongue junctions. You get leaky gut. The bloating and distension will open up your valve more, so you have more bacterial coming in, and then it can really promote and perpetuate a malnutrition, malabsorption syndrome. So the veggie mashup is not allowed. It's contraindicated when people have SIBO. But one of the things we mentioned earlier, one of the most important things you can do and you should do if you have SIBO, especially if it's long term, that you have to follow the Fodmap diet. You really want to make sure you take some supplemental butyrate. So butyrate is tolerable with SIBO, and butyrate is what your gut bacteria would normally produce with fiber. And butyrate will have a very protective effect on your gut to help resynthesize tight junctions. That's been shown in 2 studies right now. It has a major impact on dampening inflammation in the gut as well.
Okay. So people are asking, would there be any like CBC or blood test indicators to identify SIBO?
Yes. So first of all, it depends how progressed the small intestinal bacterial overgrowth syndrome is.
Okay.
In early SIBO, there's going to be nothing on a general blood test that's going to show signs of it. As a person gets more progressed, depends on what markers were done on a complete blood work. Most common panel is the CBC. That you get ordered when you do a general health workup. If you get to the point where you have SIBO that's now progressed into malnutrition, malnutrition, you're going to start to see. If it's malnutrition, you're not going to see anything involved with the CBC, but you might see something like homocysteine if it's measured being abnormal on a normal, or your vitamin D levels if they measured could be abnormal. Those would be some clues that you have some malnutrition syndrome. If it gets to the point where you start to get malabsorption issues that are crossing the line from malnutrition to malabsorption, you start to develop anemia. So that's when you start to see hemoglobin, hematocrit, RBC levels that are a little bit low. And if it progresses from there, you can see the total cholesterol drop. And the worst scenario is if you look at a marker on a blood work called albumin or globulin. If those levels are low, you've got some serious malabsorption concerns at that point. Okay. But most patterns of SIBO will not be diagnosed with routine lab work. Many patterns of SIBO won't even be diagnosed properly with the endoscopic aspiration with bacterial culturology, which is used, and breath test, because there's limitation of those as well. So again, one of the best tests to use to diagnose you have SIBO is to just do a Fodmap diet for, let's say, 1 to 2 weeks, preferably up to 2 weeks, and see if your symptoms improve. And make sure you're very strict doing it for diagnostic reasons.
Okay.
Okay, next question.
Sure. Marsha's asking, old DCs, like chiropractors, used to adjust open ileocecal valves, right?
Yeah.
Is that a thing? What do you think about that?
No, that's not going to have any impact.
Okay.
Listen, it's beyond that. We're talking about injury to the nerve plexus. We're not talking about like ileocecal valve. Look, so let me explain a couple things. Okay. For people that aren't familiar with this, people do visceral manipulation. Visceral manipulation can be done different ways. Sometimes people do it with actually touching the gut and moving the valve and contracting it. And sometimes people have reflex points, different techniques used to activate the ileocecal valve or reflex points. There's a whole bunch of different body work therapies that are out there to impact the valve. And they for some people, if they get visceral massage, they're going to stretch their smooth muscles of their gut. That's going to activate the nerve plexus, and they may get some relief from their gas and bloating for a period of time. Maybe it's 20 minutes. Maybe it's 2 days. So those type of treatments can activate the gut to some degree. Yes, but it's not reversing scarring or injury to the motor complexes. So if you have severe bloating distension, you may even want to look at visceral manipulation and gut massage and things like that. Maybe you learn to do it yourself also. And that might give you some relief from distension and bloating by stretching out those gut smooth muscles and causing some activation there. But it's not going to treat the underlying issue. It'll just be kind of used for relief care for some people. Okay,
so Chris is saying, I've heard 2 different theories on improving SIBO.
Okay.
One is crowding out the overgrowth with healthy pre-probiotics.
Yeah.
The other is using antimicrobials first, then replacing with probiotics. Do you have an opinion on either of those?
Yeah. So first of all, using a high amount of probiotics, which ones? Because you don't know what you're getting. Uh, People that have SIBO will react to probiotics. It's just that simple. So they'll react to majority of them. So which one are you using? And you may actually make the condition worse doing that. And at the end of the day, you haven't treated the underlying issue. The underlying issue is bacteria from the large intestine moving into the small intestine. So if you're lucky, you may get some benefits with that, and no way to know unless you do trial and error, right? So you could try that and try to take a high amount of probiotics and see if that can change the microenvironment, but it's very unlikely to make a significant difference. Okay, not to say it's not possible, it's just not very likely. And the other issue was to treat it with antimicrobial agents first. Well, treatments with antimicrobial agents, whether it's antibiotics or some natural agents, do give symptom relief. So whether you're using amoxicillin as an antibiotic for your treatment, or you're using natural compounds like berberine and olive leaf extract and garlic extract and other things that have natural antibacterial, antimicrobial activities, those things do help with the symptoms of bloating and distension. So they can be very useful.
Okay. Michael's asking, how does scarring occur to the motor plexus?
So scarring occurs to the gastrointestinal motor plexus from inflammation and injury. So when the gut gets severely, if you ever, you might want to Google an image and type in enteric nervous system, ENTERIC nervous system. And what you're going to see is these nerve roots, nerve bundles going all the way all across the gut lining, and then all the different smooth muscles of the gut and within the inner linings of the gut. And chronic inflammation basically injures them. And the chronic inflammation injures them, and part of the normal healing response against an injury inflammation is to cause scarring. So you actually get scar tissue development in these nerve plexes from just inflammation to the nerves of the gut over a period of time. That's why uncontrolled celiac disease, chronic ulcerative colitis, chronic Crohn's, just any kind of chronic inflammatory gastrointestinal condition, one of the worst outcomes is that they damage these nerve plexes and then end up with SIBO.
Okay.
And also, if you have moderate early SIBO, you have to realize that if you don't figure out the cause and get over it, you could be having this damaging nerve plexus progress to the point where you end up with severe malabsorption syndromes, and you end up with Fodmap diet just to be able to function without any side effects.
Okay. So.
Oh, by the way, Susan posted the article you saw on article we wrote at Dr. K News on vagus nerve activation and stimulation. So we also have an article on our website, drknews.com.
Okay, so speaking to the nerve plexus, can you eventually heal the nerve plexus if it's been damaged from years of SIBO?
So
Barbara's asking.
Yeah, so this is, maybe.
Right.
It's possible. So I don't want to say there's no hope, but if you really do have SIBO, your nerve plexus have significant injury. If you don't follow a Fodmap diet, you're gonna have some serious health problems. So that is very real. And if you have early symptoms, go in deeper and see what the cause is. So the whole field of neuroplasticity is an area of great hope for everyone that has either neurodegeneration, brain injury, or even SIBO. The ability to activate nerves to then cause them to grow and branch out is what you're hoping for. And this is why vagal exercises can be really important. So you can check out the article, Dr. K News, about vagal exercises. We talked about gargling, so which you just gargle with water all the time, and doing those consistently and aggressively for a period of time may have the potential to activate those nerve plexes, which you may not get in other ways. So the best scenario would be you do a lot of vagal exercises, which promotes plasticity and growth of nerves in the nerve plexes in the gut to deal with those issues. With any kind of, but here's the reality. When it's neurodegenerative, you're always dealing with, is the neurodegeneration, neurodestruction happening faster than you're developing plasticity or slower? So if you can slow down the mechanism of gut inflammation and change the inflammatory response in the gut and do, let's say, vagal activity, you may start to see changes in your motility because the rate of regeneration of those nerve plexuses is faster than the amount of destruction. But if the inflammation is constant, it's not being addressed, it's not being managed, and you're getting some plasticity with vagal exercises, it's never enough for you to notice any changes because the degree of destruction is greater than the degree of plasticity. So those are things to understand about how these things work.
Okay. There's a few questions combined. The Fodmap diet is so limiting.
Yes.
How long do you have to stay on it forever? I know you're answering it, but I think you need to reiterate that.
Sure.
And some people are saying, no, it's too limiting, which makes you sicker.
Right. So there's some truth. Well, there's some issues with both of those. Well, first of all, yes. If you're on a Fodmap diet, you're not in the ideal diet because you're limiting your food with lots of fruits and vegetables that your gut needs.
Right.
Okay. First of all, make sure you get diagnosed properly. So again, you may not be diagnosed properly and you're doing Fodmap and you really just have like hypochlorhydria and some enzyme deficiencies or gallbladder issue. Okay. So that's number one. A Fodmap diet is a serious health choice because you are now on a diet that significantly restricts the diversity of vegetables and fruits. It's nothing to be taken lightly.
Right.
It's a big deal. However, the mechanism of fermentation and inflammation caused by it is much worse. If you truly have injury to the gut nerve plexus, and the only way you get relief is with a Fodmap diet, it's important to do so. If you have small intestinal bacterial overgrowth and you think you want to support your microbiome and continue to eat foods that cause fermentation, distension, and bloating, you may further destroy the tight junction of the gut. You cause further inflammation. And this is why, like, diagnosis is important. Like, this is serious, you know? Like, I know in forums people throw around SIBO all the time and mast cell activation syndrome and all these things. And then people don't really know how to interpret it all. And this is also why we put together our GI gut program, because the internet has all this stuff on there. People on forums have no idea what they're talking about. Many people on forums have no idea what they're talking about, and this whole thing is perpetuated, and then it's like misinformation, and there isn't a clear thought process and so forth. So the best way to answer this is Fodmap diet has a significant issue with your gut is that you lose some degree of microbiome diversity. The only kind of compensate for that is to take some short chain fatty acids and so forth. So make sure you really need to be on a Fodmap diet, and that is the right diagnosis. But if you truly have a significant change in nerve plexus from injury, if you don't follow the Fodmap diet, you can end up with some serious health problems. So both, it's true. You should diversify your diet, yes, but if you have true injury to the nerve plexus, Fodmap is unfortunately the way to stay healthy.
Right.
Yeah.
But that's with having been diagnosed.
Make sure you ruled out everything else and gone through all the steps.
I think people just jump.
That's the key thing too.
Is the problem.
Yeah. So here's the thing you should understand.
Yeah.
If a person doesn't have SIBO and they go on a Fodmap diet, they're going to go off sugars. They're going to feel better. Okay. Yeah. They're going to have some degree of energy. Doesn't mean that they necessarily have SIBO. And then if they stay on a Fodmap diet forever, then they're going to lose microbiome diversity. So the key thing is this really or when you do a Fodmap diet, are you just getting rid of some of your bloating distension? Maybe because you have dysbiosis, and eating sugar makes you bloated and distended, and when you're off sugar, you feel better. And maybe it's not Fodmap. The biggest clue for that is vegetables and fruits are not really an issue. It's just simple sugars and unhealthy foods. So if it's really the unhealthy foods that are a problem. But if you're eating like cauliflower and you get severely distended, or lettuce, that's not dysbiosis. That is more likely Fodmap. So you got to understand that when you're doing the Fodmap diet, being off sugars has an impact on the gut that may make you feel like you have Fodmap, but it's not really just being off. It's not really you have SIBO. You just off sugars. So your gut doesn't have all those things stimulating all these adverse bacteria that's causing dysbiosis. But if you're eating foods that have galactans that are healthy foods for you, like for example, we talk about broccoli, beets, cauliflower, lettuce, and those are high in galactans, and you get severe bloating and distension, then you really have to lean towards, you may actually have SIBO. So those are some things to really think about. Thank you for asking those questions. That's very good.
It's a good,
Yeah.
Okay. Michael's asking, if a person tests positive for H. pylori, which may have led to SIBO with bloating, belching, whatever, with meals, would correcting H. pylori, do you correct H. pylori simultaneously with SIBO? And would fixing H. pylori clear SIBO?
Yeah, so technically, if your small intestinal bacterial overgrowth is caused by not having enough hydrochloric acid, stomach acid, to change the environment of your small intestine, secondary H. pylori, if you treat the H. pylori, you should fix the SIBO. It may take a few weeks, but you should be able to notice a big difference. And you don't necessarily need to follow a Fodmap diet. You might want to just, treat the H. pylori with whatever treatment is appropriate for it, and then see those tests go negative. You may even want to start taking some hydrochloric acid. And by the time you start taking some hydrochloric acid and you have a negative H. pylori test, if that was the cause, all of your distension and bloating symptoms that are associated with SIBO should be gone or dramatically reduced.
Okay, Miriam, hi Miriam, is asking, is there a questionnaire or something you recommend for a person to recognize they may have SIBO? If someone's worried about something.
Yeah, we have questionnaires in the gut health program that goes into all the different diff dyes and all the different mechanisms. But the main symptom of SIBO that you would put on a questionnaire, that would be the key takeaway, would be bloating, distension, and gas from eating fiber, healthy foods, sugars. Not so much the sugars, but I think it's better to focus on just vegetables and fruits, especially high sugar fruits causing bloating and distension.
Okay.
I mean, like if someone ate maple syrup with pancakes and then had a Snickers bar, you're going to expect bloating and distension. That's pretty normal. It's a high amount of sugar, fructose load to the gut that is going to change the environment of the gut. But if eating cauliflower, beets, salad is causing distension, that's inappropriate.
Okay. Jonathan's saying she has a certain butyrate product and it says to take 3 times per day. Can someone with a bad gut take more than 3 capsules a day?
Yeah, with butyrate, you want an experiment. Butyrate is not based on your age or your body weight or your symptoms. It's one of those supplements where you should experiment and see what the right dose is for you. There's just short-chain fatty acids. You're not gonna, you can take quite a bit of them and have no problems at all. Most likely won't have any problems even with high dose, except if you take too much, you may just have your bowel change and have some issues with that. But you should experiment with the dose and figure out what works best for you. There's usually a point where you notice taking more, maybe three a meal 3 times a day may be better for you than just 3 times a day. But taking it 4 times a day or taking 5 capsules 3 times a day is not really different than taking 3 times a day. So that's how you figure out your dose. You'll have to experiment and see what works best for you.
Okay. Sorry. Can you talk about the elemental diet?
No, I really don't have. It's not something I incorporate, so
okay.
I don't have much comment.
Okay. And Lisa, does fasting help?
Yes. Thank you for bringing that up. So fasting can be a big thing when it comes to SIBO. So fasting, and you can do different types of fasting, but there's basically long-term fasting, which is more than 3 days, and then intermittent fasting, which is you can do it every other day. You can do 2 days on. You can do a 3-day fast. You can do time-restricted feeding, where you fast for 18 hours, eat for 6 hours. Most common way people do intermittent fasting is with time-restricted feeding, and the most common time-restricted feeding is what's called an 18-6 program, where you fast for 18 hours and eat for 6. So you basically may eat at 2 o'clock till 8 o'clock. And then coffee and tea are permitted during the intermittent fasting period. So you can wake up in the morning, have coffee, and then wait till 2, and then eat, and then you can eat all the way up till 8. That would be a typical intermittent fasting approach. But intermittent fasting turns on genes that help with nerve growth and have an anti-inflammatory effect of the nervous system, and including the enteric nervous system. So it's a really good idea to include in your protocol with SIBO not only a Fodmap diet, vagal exercises, but intermittent fasting. And actually, the last part of the gut health course we put together, I have a whole section on intermittent fasting, because it does impact many gastrointestinal conditions, and SIBO is one of them.
Okay, so a lot of questions on the veggie mash. I'll just combine some.
Okay.
Can you use dried veggies, freeze dried? Like,
Yes.
is raw better? Is cooked better? Like a lot of.
Yeah, so with the veggie mashup, you can use dried veggies or raw veggies as long as you get the fiber. All you need is the fiber. If you get the fiber, you're good. So that's what you're after. So you can use dried or regular veggies and still get the benefits.
Okay, Elena has a super simple question.
Okay.
Can you please explain the connection between hypothyroidism and SIBO?
Yes.
I'm being silly when I said super simple.
Well, hypothyroidism, so thyroid hormones bind to the vagal motor complex and activate it, and thyroid hormones bind to the nerve plex receptors to cause smooth muscle contraction. So if someone's hypothyroid and their body, their thyroid gland isn't working well enough to produce thyroid hormones, there's less activation of the vagal motor nuclei, and there's less activation of the gut nerve plexus. And with that lack of activation of the gut nerve plexus, there's decreased motility, so the valves of the gut are not contracting, so bacteria can go from the large intestine to the small intestine, or the valve itself between the small and large intestine. The ileocecal valve's not working, so you can get some of these patterns. And actually, and so as soon as someone's hypothyroid, they go on thyroid replacement, they feel a lot better. Now, one of the most common symptoms of undiagnosed hypothyroidism is just chronic constipation, and you can add SIBO on top of that. So thyroid hormones are critical in activating the nerve plexus because they bind to the nerve plex receptors in the gut and throughout the brain stem, are stimulated by thyroid hormones.
Yeah. Okay. To activate the vagus, how long do you gargle? Should you gargle?
Yeah, so when you're doing the gargling exercises with the vagus, basically you want to take like a large glass of water and then just take a sip and then gargle for as long as you can and then swallow or spit it out. And then it may take you, I don't know, a dozen gargling to finish an entire glass of water. And you can do that several times a day. 1 time a day is okay. 3 times a day is better, but you really want to gargle as long as you can, and you want to gargle as aggressively as you can, and you want to gargle to the point so aggressive that you even have some tearing. That would be nice, but that's the basics of gargling.
So why do you want tearing? What's the?
Oh, the tearing. So when you're looking at the vagus, the vagus nerve is right directly next to what's called the superior and inferior salivary nuclei, and these are the nuclei that cause saliva production and tearing. And when you activate one, phylogenetically activate the other ones, so you know you're really hitting that brainstem area. Now, people that have some significant loss of function, they can gargle as aggressively as they want. They won't get any tearing. And then once they start to activate that center over and over again, they'll start to notice they're getting tearing, which is a good sign that they're actually activating their brainstem more effectively and their body's responding. So that's where the tearing comes in. Okay, last question.
Hold on, there's 2 more.
More?
What's tearing?
Tearing?
Yes, you're not.
Eyes crying.
Yeah, there you go.
Sorry, I slur words.
That's okay. We're like, what? Okay. This is a good one, actually. Okay, so a couple people are talking about fasting, and they're saying, I'm worried that if I fast, my blood sugar will drop, and I'll strain my adrenals.
Oh, yeah, sure.
I get attacks. Can you please address that?
Yes, we actually did a talk on this.
I was going to say, there's a whole...
if you look at our library, past talks, we did a talk on...
Intermittent fasting?
I think it was intermittent fasting.
I think it was.
Yeah, intermittent fasting, yeah. So if you have hypoglycemia and you have a tendency to have your blood sugar drop, you definitely don't want to jump into intermittent fasting. Right. You will definitely get worse and crash. So the best scenario in those cases is to actually go into a ketogenic diet first, and then stay in ketogenic diet for probably 6 to 8 weeks and get what's called keto adapted. So your body gets efficient using fats instead of sugar for energy. And how you know you're getting keto adapted is when you're eating a ketogenic diet, somewhere around the 4th week, 6th week, 7th week, you're just not hungry. You wake up in the morning, and going to 2 o'clock to do an 18-hour fast just happens on its own. So that might be the only way to really get into intermittent fasting if you have hypoglycemia patterns. So you have to kind of shift your metabolism into a keto adapted state by following a ketogenic diet for a few weeks, and then you can do intermittent fasting. And then once your body gets keto adapted, you may not have to stay in a ketogenic diet, and you can still do the intermittent fasting, but your body is more efficient doing it, and you may need to still have high healthy fats in order to do it, even though you're not in full ketosis. So that's how we talk. We talk about them more in that talk we did on intermittent fasting, but that's the basic concept. Okay. Okay, I think that's it. Thank you, everyone, for joining us. Please check out our Gut Health Solving the Puzzle at Dr. K News, drknews.com. Sign up to get the information about the course, and we'll have discounts and promotional items to give away for people that signed up early. And thank you for joining us. And we'll have some gut-related topics the next few weeks as we promote our new course. Thank you so much.